Welcome to the Women's Health Channel. My name is Gabriel Igberase. Today I'll be talking about infertility, the causes of infertility in Nigeria. Infertility is the inability of a couple to achieve pregnancy after 1 year of unprotected, satisfactory sexual intercourse. If a woman is 35 years of age and she has not gotten pregnant for 6 months duration, she's also termed to be infertile, or if she's been having recurrent miscarriages. Prevalence is about 10% to 50% worldwide. It is a couple's challenge, and it is not the challenge of the woman alone, as it is known that 1/3 of the cause of infertility is attributable to the man, 1/3 to the woman, and another third to a combination of the man and the woman. But recent studies have shown, and I've done one of those studies, that much more than 1/3 of the cause of infertility is attributable to the man. In my own series, I found out that 62% of infertile couples attending my infertility clinic, that's 62% of the cause of infertility was attributable to the men. And you know, we basically live in a patriarchal society where we tend to blame the women a lot, and the men don't come for investigations and they say, oh, my girlfriend has been pregnant and all the rest. Not until you show up in the infertility clinic, you know, you can't really say that you are fertile. So you have to show up and do all your andrology workup, your seminal fluid analysis, your hormonal assays, and all those tests, and that will be able to say, oh, that you're good, right? It's a couple's challenge, and we should stop the trading blames on our women. I'll go straight to the causes of infertility. First of all, with the women, if we look at the reproductive tract of the woman, starting from the vaginal vulva, it could get blocked or it could not be formed at all. The neck of the womb can also be blocked. The cervix, from insertion of harmful concussions that are toxic. The inner lining of the womb can be riddled with uterine fibroids and can also be adherent together from concussions or from unsafe abortions. The fallopian tubes can be blocked from previous operations, previous fibroid operations. It can also be blocked from infections like gonorrhea and chlamydia infections. The ovaries can have challenges with ovulation, and the concept of polycystic ovarian syndrome, which hitherto we thought was more common with the whites, is being seen in our clinics very rampant these days. So that causes anovulation, meaning that the woman cannot ovulate. So we have that also as a cause. General disease of the woman, like diabetes mellitus, those who have had chemotherapy for cancers, you know, could also have infertility. But the peculiar characteristics in our environment is sexually transmitted infection, not from staphylococcus, as he said, from Neisseria gonorrhea and chlamydia trachomatis infection, more commonly. So that is female infertility. For male infertility, the same infection from Neisseria gonorrhea, chlamydia trachomatis, they should be promptly treated. They can also affect the ducts of the man, just as the ducts of the woman can be affected. Apart from infections, you could have an inherent problem with the testicles. Maybe they are not well formed, or probably the child suffered from mumps or orchitis when she was a child, maybe from testicular trauma or from surgeries like hernia operations. You know, if it's not done properly, the vas deferens, you know, could be tied off. That is why you should see a pediatric surgeon when you want to operate on your child, not visiting charlatans. Pesticides, the lifestyle of the man is also very important. Those who take marijuana, Igbo destroys, what we call Igbo in Nigeria, in the Niger Delta, destroys the sperms a lot, the sperm cells. Smoking also destroys the sperm cells. Heavy alcohol drinkers also would have challenges with sperm cells. Pesticides, those who work in radioactive companies, those also who have metabolic conditions, those who take what you call, I've mentioned alcohol before, all these are causes of male infertility. I've talked about pesticides, also for men who use chemotherapeutic agents for cancer treatment. Men who are using some antihypertensives, not that it will cause infertility directly, but it will affect erection, so they may come down with erectile dysfunction. Metabolic conditions like diabetes mellitus, thyroid toxicosis are associated with both male and female infertility. But I want to conclude, I want to state that the peculiarity of our environment are these: sexually transmitted infections, which is rampant from unsafe sex, chlamydia, trachomatis, Neisseria gonorrhea, is a chief cause in our environment, not Staphylococcus aureus. We should take note of that. This same chlamydia, trachomatis, Neisseria gonorrhea will also affect the fallopian tubes of our women. We should also take note of that. So prompt treatment and prevention is very, very important in this regard. Then unsafe abortion is a big challenge in our environment. It's clandestinely done, and it's done a lot by quacks or by those who do not know how to perform abortions. And I've removed bones, I've removed plenty of pus from the wombs of women, before they were able to get pregnant. So if you prevent all this, you won't come down with infertility in the future. So these are the peculiar characteristics in our environment, and largely we can prevent all these problems. Thank you very much for listening.